Okay, hello, do you hear me? No? Okay. And now? Oh. Okay, and now? Okay. And now? Okay. Oh, I need the clicker. Mm-hmm. Okay. Can I start? Okay. Hello, my dear colleagues. My name is Antonina. I'm from Ukraine, and I'm international trainer of Hyalual company. And it's a big pleasure for me to be here and share with you my own experience. And I want to tell you about my favorite fillers, because in my clinic I use a lot of skin boosters, a lot of fillers, but in some cases you need to know which you have choose and which you have to work with. Know which patient better for this or this filler, for A or B, procedure. And you need to understand the components, the ingredients, which advantages you need to know from all the fillers. Okay, and we will start from this picture, and our patients, they usually come to us and they don't understand what the layer change and what the procedure is better for them. Usually they understand, they see just a picture in the mirror. They just see like a flat paper on their face and just see some wrinkles, and they say, I want to remove this wrinkle. They don't understand that changes become in different layers. The bone structures, muscles, and deep fat and superficial fat, dermis and epidermis. With age, different layers changes. That's why we need to know all the layers, and we need to know good anatomy, and then we have choose different procedures for all the layers. And you know that you can take 15 or 20 milliliters of filler and create some ball, but it's not about beauty. And you need to choose different procedures, and when you work with all the layers, you can create more natural and good result for your like specialist and for your like specialist and for your patients. I want to create maybe some discussion between us, because it's very interesting for me in different countries which procedures you like and which fillers you like. Have you ever tried our Hyalual fillers, Alexa? Who have tried? Who has tried? No? No one? Oh, wow.
After this, yeah.
Okay, it's a new filler for you. Okay, and our redermalization with succinic acid? No, okay. A lot of information, I think I will show you. When we understand what changes with our skull, yes, we can just watch this picture and understand where the child and where the old person, you know, and we can see that resorption of the bones. It's very big amount of skull we lose with age in the middle third and either this part, yes, and our forehead and these holes become bigger, and we have a lot of empty spaces, and we just can a little bit feel it, and that's all. Okay, and another layer, it's deep fat and superficial fat. And when we talk about this deep fat, it change like superficial, yes. And in young person, there's fat like Parmesan, you know, like a cheese, hard cheese. And with the age, it become like a camembert or brie. You know, it's like a melted cheese. And that's why we need to put some substances to this fat, because we want to change the structure of this fat, not just only bone and just only dermis. We want to change the structure of this fat. That's why I like to use polynucleotides and our succinic acid and put it into the fat, and not just only into the dermis, and not only just fillers. About muscles, here is just about botulinum toxin, and that's all. But you need to know anatomy of these muscles, because if you put filler to some parts of our face, but you don't use botulinum toxin in the platysma, you know that fillers can change the place, and this work in platysma can change all the face. Okay, and about laxity, you can see that some ligaments, yes, stand on the same place all our life, but laxity of skin, but fat structure changes, and you can see the these shadows on our face, and we want to change these shadows. Sometimes you have to ask our patient what about their teeth, because sometimes when they don't have teeth and want to inject their lips, you put lips and you have empty mouth and just like sticky lips, you know, under this mouth. That's why I like to use with the whole this area, and then just only a little bit into the lips. Okay, and our patients usually knows where are the ligaments. Usually they come to us and say, I want not this, I want this one. Yes, they very good knows where is the ligament which keep our smas on their place. Okay, and about dangerous places. Who knows safe places on our face? I don't know. Usually it can be possible because we have a lot of arteries and veins, and we know about our anatomy. We have the common artery, yes, we have the external branch, the facial and temporalis, and we know the facial branch here is deeper and here is more superficial. This here is more superficial, and here is the anastomosis with the inner carotis, internal carotis artery. That's why this place is I think the most dangerous place, because here is blood pressure in this branch more than inside arteria ophthalmica, and that's why if you put the filler into this branch, you can cause blindness. That's why we have to be very carefully in all these places, but usually you never know where it is exactly. Usually we need to put small amount of filler. If we work with the needle, it's on the bone with some tests, yes. And if you want to work more superficial, usually we use cannula. I like to use 22 or 23 gauge cannula, long cannula with one hole for half and face, and I think if we will have some model for this procedure, I will show you how I work with the long and thick cannula. It's very safe, maybe more painful for our patient. if we compare it with 25 cannula, but it's more safe for us. And I found few articles in PubMed, very interesting articles, when the patients with alopecia come to the doctor, and doctor said that it was ischemia of this branch. And you know, if it's a compression, not just embolia, but only compression, you can see alopecia on this area. And when they dissolve all the fillers from this area, after the maybe 4 and 6 months, the hair become growth, and everything was okay. But it was very dangerous to inject, and if you work with this area, in the temporal area, you have to watch very good the blood circulation around this working space where you work. Okay, and which complications can be after fillers? Which you know. It's ischemia, yes, it's some inflammation. What else? Fibrosis, yes, maybe some granulomas. And what the reasons of these complications? The first and most important for me, it's a product which you choose for injections. And I think all this new material, it's something worth for you, but the next few slides I will show you that it's very, very simple and very important characteristics of fillers. And after this lecture, you will know about all these advantages of different fillers, not only Alexa. Okay, we have 3 fillers, but the first 2, it's common fillers in all of the world, because the first one, smooth, is just in Ukraine or maybe some more countries. It's some new, and it's not popular in different countries. But medium and volume, it's a very good fillers for different areas with different characteristics. Okay, and I want to share with you some information about hyaluronic acid, yes? We know that hyaluronic acid is in our organism from birth till our death, yes? But it's a low molecular weight hyaluronic acid. We have some, this polysaccharide with some links. This is natural links. It calls van der Waals links. And usually fibroblasts, you know, just only one cell which create collagen, elastin, hyaluronic acid, and hyaluronidase. It's just one cell. It's a fibroblast, and usually we want to stimulate it, yes? And we don't know what we stimulate. Just only kick our fibroblast and work and work and work. And we need to know that when we put different types of hyaluronic acid into our cells, we have different effects. If we put just only low molecular weight, we have pro-inflammatory effect. If we put high molecular weight hyaluronic acid, we have anti-inflammatory effect. And our organism creates just only low molecular weight hyaluronic acid, and it creates and breaks every minute. We have around 15 milligrams per kilogram every minute in our organism. Yes, in our I don't know, spine, in our dermis, in muscles, everywhere we have hyaluronic acid. And if we want to create some good product, because you know, in the past, maybe 10 or 12 years ago, we used just only low molecular weight because we didn't have the high molecular weight hyaluronic acid. And when we used that mesotherapy, we know that we should make maybe 10 procedures every 7-10 days, because its results was very short, and we want more and more and more. We want pay maybe bigger price, but we won't rarely get these injections and have more long effect after these procedures. That's why chemistry has created for us high molecular weight hyaluronic acid. And you know, a lot of different articles in medical publications told us and tell us about good effects of high weight molecules of hyaluronic acid. Anti-inflammatory effect and good reparation. Okay, but our skin boosters and this hyaluronic acid may still in our tissues maybe 3 days, maybe 7 days. But what with the filler? Filler can still 1 year, 3 years, 7 years. Sometimes we can see this Tyndall effect about 7 years after the injection. That's why we need to know what we can do with the hyaluronic acid for this result for years. We just can create some clock with synthetic links, because these natural links, it's not stable, you know, and that's why we need to put some synthetic links. Usually it is BDDE, and that's why hyaluronidase have to work more and cut here, and just only after that get out from our tissues. And you know, this mark, it's very important, because if we have more than 4% of BDDE inside our filler, we have very hard material. It's not like a gel. That's why we need to know how many BDDE is in our filler. And if we have this cross-linked BDDE, it's not toxic for our tissues. It's just about elasticity and viscosity. And when we talk about free BDDE in our syringe, what can be with this BDDE in our tissues? It just can accumulate in our tissues. And this BDDE is toxic for our organism. That's why this mark, this level of BDDE, it's very important, amount in our fillers, in our syringe. And when we buy some not certified material, we never know about this BDDE. That's why it's very important. And when the manager comes to you and say, this good material, you know, take it and inject. You have to ask this person about BDDE and about high molecular weight hyaluronic acid, because Alexa filler, it's clean from this low molecular weight. It just is trash inside syringe. It's just a free material and can cause some result, yes, and this hyaluronic acid can't fill our tissues. It just dissolves after a few minutes inside our muscles, inside our fat. That's why it's important. High molecular weight hyaluronic acid, BDDE. The next, it's a pH. You know, our tissues have 7.36 and 7.38. Yes, this normal level of pH. And Alexa fillers has 7.4, 7.42. You know, usually the producers of different fillers use lidocaine inside. That's why you never know which pH, because you don't feel it. But if you use Alexa, you feel some compression, you feel some pressure, you feel maybe some painful, not just pain, you know, some inside your tissues. But when the creators put the lidocaine inside your syringe, you never know about pH, but swelling the next day after the procedure will be bigger when you put the lidocaine and when you don't know this pH, because pH usually lower than pH of your tissues. That's why we can see the big swelling after the procedure. That's why when you use good pH in our product, we have lower swelling after that and shorter down time. We have good reparation after the procedure. And when we use lidocaine, we never know what were the tissues around, yes, because sometimes we have this whiteness, some discoloration, and you just see and think, it's ischemia or just lidocaine. And here is now lidocaine, that's why it's more safe for me, and it's better for this amount of downtime for my patients. Okay, and the next. pH osmolality, yes. Usually in the past, maybe I use Alexa fillers maybe last 5 years, and before I use more fillers than now. Now just only 2, 3, 4 companies, and previous it was more. Often I saw this effect when my patient in the morning have the lips and in the evening don't have. You know, this osmolality, when you have 1 milliliter, but after a few months you have not 1. Sometimes it's a 3, sometimes it's a 2 milliliter, and sometimes it's a half of milliliter, because it's not stable. And when you take the syringe, how many hyaluronic acid inside the syringe? Usually milliliter, but hyaluronic acid in the syringe, not all amount of product. 2%, 20 milligrams per milliliter. It's just 2% percentage of hyaluronic acid. And all another material, it's a buffer system, which can get this stable effect. And it just this solution of hyaluronic acid and buffer system, just only 2. Sometimes it's lower than 2, and sometimes it's more than 2. Yeah, some maybe 2.5. That's why it's very important for us which buffer system inside the syringe. Okay, integration, migration, and fragmentation. You know, when we have this clog with BDDE and hyaluronic acid, and when the manufacturer wants to get maybe more liquid filler, but with a very long result, they can put more than 4%, because 8% of BDDE, it's just like a sand, like a glass maybe, yes? It's very hard material. They can just cut this filler and create these small particles. And after putting these particles into the tissues, you have this fragmentation inside, and you can feel it in the lips. Maybe sometimes our patients feel it on the bones, and they said about it. Our fillers very mild, and if you put big volumes, you can just make some massage, and this filler integrate in between our muscles, between our fat tissue, and you can see this mild result. And my patients likes it very much, because we have no boluses inside lips, no feelings inside tissues. And about migration, you know, sometimes when the lips is very active muscle, very tiny lips, and you want to put more, migration will be every time, you know. Usually it migrates, all the fillers, because if you put it superficial, in a very good amount, but our patient want more, our patient want more often, to put the fillers inside, into their lips. And you can see this mustache around, yes, usually, because we have orbicularis oculi, and when it contracts, we have this migration, because here is a lot of material and here is the empty spaces. And filler usually migrate to this part. And you can see the line around these muscles. Not to this part, yes, just only inside your muscle. And I like to use some hyaluronidase around the mouth, just only like a hyaluronidase water, you know, small amount of hyaluronidase, big amount of saline, and you just can dissolve this migration around the lips. If you don't want to dissolve just only lips. Okay, and if you use some filler, unknown fillers with some another cross-linked with a big amount of BDDE, sometimes it doesn't dissolve. And for me, it's disaster, because sometimes I make this procedure few times for dissolving some amount or some bolus inside the lips. Okay, volumization, filling. Yes, about 1 milliliter. If you have good hyaluronic acid with good cross-linking, without any this free non-crossed BDDE, very small, very tiny amount, yes, and you put 1 milliliter, you want to get 1 milliliter, not more and not less. And usually you have to explain to your patient that if you put 1 milliliter, it can stand just whole the year 1 milliliter. After the few months, you know, this maybe can be half and from result. Yes, maybe 50% from result after a few months. But every person are individual, and sometimes it can be 3 months, sometimes it can be 3 years, because our own hyaluronidase is different. Okay. We have all the certification, and it's a very important part, because for getting these certificates, you have to spend a lot of clinical science resources and have a lot of articles and publications, and you have to spend some clinical studies with a lot of patients. That's why it's very important, because we know that this filler is safe. When we inject this filler, it's safe. Okay, and now after this scale, you can understand some from this part. Yes, you can understand that we have good hyaluronic acid. Now it's all HDL. In the past, it was some part from Shiseido, Japan, and some part from HDL, but now it's all from France. And we know that when we have good quality first hyaluronic acid without this bacteria's DNA or some bacteria's material, it's more safe, because after 1, 2, 3 years, we know that we won't have this biofilms and this granulomas or something like some inflammation, because sometimes it happens when our patient come to us after 7 years and we haven't filler, but we have some granulomas or some fibrosis. It's because of hyaluronic acid. It's the quality of hyaluronic acid and BDDE also. Okay, and when we use low temperature during the manufacture, we can save this natural links. That's why we need less amount of BDDE, because we save these links with this low temperature during the manufactures. Okay, and we use this unique buffer system, and we have good pH and good osmolality. Okay, and here is about BDDE. You know, FDA needs to, when you want to FDA approved, you need to put just only clean from this free BDDE. And what this means 1 ppm, parts per million. When we have 1 million cross-linked BDDE, we need to have less than 2 not linked BDDE, not cross-linked BDDE inside the syringe. Alexa has less than 1 parts per million. Okay, and this fragmented sizes, it's about this cutting the filler inside syringe. Okay, it's something like that, yes? Van der Waals, it's natural bonds, links, and synthetic cross-links. Here is BDDE. You know that in the world we have NPEG and divinyl sulfone, but usually it's BDDE. Okay, unique buffer system, I told about that. Oh, okay, and if we talk about BDDE, cross-link BDDE, partially processed BDDE, and free not cross-linked BDDE. This BDDE is toxic for our organism and can accumulate and cause fibrosis after 3, 4, and 5 years. Okay, pH. In this scale, you can see that different fillers was participant from this research, but all these fillers had CE marks. Yes, all European. And you can see that pH was low than our physiological, but usually the fillers hide the pH by the lidocaine. Okay, osmolality, good result from all the fillers in this research. And about volumizing, when we have 1 milliliter, after adding some extra water, we have just 1 milliliter because it's like a finished product and have good osmolality. Okay, some conclusion. Do you understand all the material? Is it interesting for you? Okay. I'm satisfied. And we will talk about medium and volume. We have just only 17.5 and 20 milligram per milliliter, 1.75% and 2% hyaluronic acid in 1 milliliter. BDDE, the same in all the syringes, less than 1 parts per million, and reticulation, it's about BDDE. Yes, it's an amount of BDDE, synthetic crosslink, 1 milliliter in every syringe, sometimes 1 milliliter and a little bit more. It's like an extra bonus. And we can use it in different areas. We can use medium for more superficial wrinkles, for lips, for our hands. I like to use it with our Hyalual with succinic acid. It's our redermalization. I will show you the results. And I mix it between syringes, mild filler with our skin booster, and fill the empty spaces inside hands, and I have redermalization, good reparation, and mild feeling in my hands. I used it maybe 1 week ago for myself. I like to use our products for me. Okay, it's about G prime. It's like high mathematics, but I want to try to explain for you what is G prime. When you can push the gel through the syringe, but filler can keep the volume inside tissues. It's this G prime. Keep the volume, but push through the syringe. Yes? Okay. Clinical studies. Some women's, you know, this Guy's scale, it's a very interesting scale when we take the opinion of patients and opinion of our specialists who injected the filler into the tissues, and we have some results and we have some numbers after this, and usually when we use good filler we have good results. That's why we have very good results with the scales. Okay, lip volume walls, medium third, and different. I don't want to stop on this slide because I think the next slides will be more interesting for you. It just, for lips, 2 milliliter, you just see that a little bit more volume on the photos, but usually our patient in the mirror can see more volume, but on the photos you just can see a little bit, like 0.5 milliliter maybe. Okay, and this is very important because after 6 months we showed that on the ultrasound no fibrosis. Okay, no fibrosis, no extra blood circulation around the filler because we don't want this inflammation, we don't want the fibrosis after the injections, and we can see just loss of amount of filler, and it's very important for me, like for specialists. Okay, another one, 1 milliliter, and the same. We just see the loss of amount of filler without any fibrosis and any inflammation around the filler. Okay. Periorbital area, why we can use it with our, not teeth root, I think, maybe this middle part of our face. Our filler don't get extra water around, but if you use a lot of fillers in this place, you know that you can press the lymphatic system and you can swelling more than previous. But if you put a little bit of filler when it needs, you can have a good result. I usually swell because I have a lot of flights and I have diabetes, and usually I'm like a ball in the morning, but a little bit of filler don't make some problem for me, you know. Swelling like previous. That's why it's safe for me. And I have diabetes from 2000, yes, I'm 36. From 12 years I'm with this insulin. That's why I know that this filler is safe for me, and our redermalization, it's perfect for my trophy of tissues, and I will show you some results. It's amazing. Usually I want to put our Electri and Hyalual Acceleraderm into all my body, you know, knees, elbows, and neck and decollete, and I see the result. I see the moisturizing, I see this glow effect, and that's why you can use it with different diseases. Okay, and no migration as usual, yes? You can see we used not to the teeth root, because you know that when you put filler to this part, I can show here, here is the X space. And when you use a lot of filler to this wrinkle, usually it migrates to this part and you have like a blue sausage under your eyes. That's why I don't use a lot. I use with the cannula, but on the bone, under the ligaments and under the muscles, and I have this like a support effect to this place, but without this feeling of this wrinkle. Okay. Oh. Oh, and you can see without teeth root, with just the second part, yes, middle part. Okay. Lips, cheeks, jawline. Usually I don't use more than 4 fillers. It's very rare situation when I use 4 fillers. Usually it's 3, 2, 3, sometimes 4. But not more for one procedure. Maybe after a half months or maybe half a year, yes, I can put extra, but not a lot, because I have some filler here, and you can see it. But when I swell, I can push and I can see where is the filler, because I have this some relief, I don't know, resurface this not straight surface. And here is the cheeks. Okay, and about my favorite products, it's Acceleraderm, and when we use it, we have to remember about our cells, about our mitochondria. Our mitochondria, it's electricity station of every our cell in our organism, not only on the dermis, it's in the brain and it's in the kidneys and every organ. Okay, and when we put the succinic acid, we put extra energy. We put like a battery into our cells. That's why our cells live the better life. And we just improve our health of our skin, and just like a result, we have some beauty and this glow skin with a good color, with a good moisturizing effect. And in the 2017, we got this reward in Monaco for our double synergy effect. We have a lot of different articles about this double synergy effect, because we have two products inside one syringe. It's a high molecular weight hyaluronic acid, which can get anti-inflammatory effect and moisturizing effect, and succinic acid. Succinic acid, it's a unique product. It's a metabolite of our Krebs cycle. That's why we have a lot of different effects, our injections with this product. Succinic acid can cause normalization of energy metabolism, anti-hypoxic effect, antioxidant effect, cytoprotective effect, activation cell proliferation, synthesis of structural proteins, anti-inflammatory action, improvement of microcirculation. And when I tell you about diabetes and atopic dermatitis, and sometimes I use it with psoriasis and rosacea. Rosacea, always I use Acceleraderm because it's a perfect product for this persons. And hyaluronic acid helps to prolongate the result from succinic acid, and this high molecular weight have more anti-inflammatory effect and moisturizing effect. And when we use, could you tell me, you have all the Acceleraderm, yes? Electri 1.1, 1.8, and 2.2. When we use 2.2, it's more concentrated with the hyaluronic acid. Succinic acid usually always the same. It's 1.6% of succinic acid. It's a physiological concentration, and hyaluronic acid different. Electri is 0.55, 1.1, 1.8, and 2.2. When we put 2.2, it's like a support in our tissues, because if you imagine that our dermis, it's like a mattress, you have the springs, it's like collagen and elastin, and these soft tissues, it's a hyaluronic acid, and with the age we have this not strict relief, that's why resurface. That's why we need to put some hyaluronic acid into this mattress and fill this good volume. That's why we need to put 2.2 to aging skin, to very dry skin, and you will get better results. And sometimes when I inject the polynucleotides, previous I just used polynucleotides, and now I first use Acceleraderm, and after the course of Acceleraderm, I use polynucleotides. And my patient sometimes said to me, wow, something new some use polynucleotides, amazing effect. And I think, oh wow, it's a very, you can explain it because you like a prepared skin for polynucleotides, because if you want to build the house, you need builder, it's a fibroblast. You need the blocks, it's polynucleotides, it's amino acids, but if your builder is hungry, you never build this building. That's why you need to give it energy, this fibroblast. You have to feed this fibroblast. That's why when you prepare with the Xela your fibroblasts, you can, after this course, use anything else. You can use polynucleotides, you can use lasers. I use yellow laser. I have Asclepion quadrasarpo. I have Dermablade Asclepion. And I have radio frequency microneedling. And usually I use Celeroderm, and after that I use aggressive procedures. And for me too. Sometimes I know that specialists cancel the appointments when they know that a patient has diabetes, but I'm not afraid because I prepare my skin with Celeroderm and I have good results, and I have shorter downtime if I compare it with another patients without this preparation. That's why I like to use these products and use it a lot. Okay, we have this different effects because I explained to you, and we can influence to our fibroblasts and macrophages because all these tissues has the receptors for our succinic acid, and it were a lot of different research works, and we can compare control group with the Celeroderm, and if you see the fibroblasts, like a soldiers, like a military, very strict around the blood vessels, and we can improve our blood circulation because we can influence to growth factors, and our growth factor is very important things when we talk about reparation after the inflammation, because every injection is inflammation, every aggressive procedure is inflammation, and when we can cause accumulation of growth factors, we can regulate this reparation. We can influence to accumulate tissue growth factor, fibroblast growth factor, and blood vessels growth factor, and it's very important when we want to remove some inflammation in our skin. And we can see that in our adipocytes we have these receptors also. That's why we can put our Celeroderm deeper, not only into the dermis. But if we want to treat hyperpigmentation, dryness, irritation, in our skin, yes, in our superficial layers, we can inject more superficial with this white papulas. But when we want to improve our fat tissues, our ligaments, we can put it deeper. We can put superficial and deeper without white papulas on the surface. You can inject 1 or 2 syringes. Different patients can buy different amount of the products, yes, and different doctors like to use in different ways. You can use it with cannula, not only with the needle, and I like to use it with filler mixed between the syringes to feel the hands and sometimes to feel the décolleté. Okay, it's about Krebs cycle, and you can see that here is our succinic acid. And after every Krebs cycle, our organism can create 36 ATP molecules. But if something going wrong, we can get less than 36, and our cells can't live their lives, yes, and we can get apoptosis. That's why we want to put some extra energy, we want to put some extra battery into our cells. And this is very important for me, like for diabetic, yes, and that's why when I use the inhibitors of this growth factor, because my retina suffer from my level of glucose, that's why I can use this product for my skin and have better results and get good skin quality. Succinic acid has anti-inflammatory effect, and we can see that hyaluronic acid, high molecular weight, can cause anti-inflammatory effect, and succinic acid can cause anti-inflammatory effect as well, because we can transformate macrophage M1 to M2. And after that, we have this anti-inflammatory interleukins and have anti-inflammatory effect. I like to use it with my patients who take the retinoid pills, because usually when they take retinoids, they want to work with the post-acne at that moment, but you can't use anything. You can't use lasers, you can't use some peelings, yes, but you want to use something for this post-acne scars or some red spots. That's why you can use this product. And when you have this irritation, dryness, and you can put 1.8, because usually in the young person I use Electri, yes, small amount of hyaluronic acid. But if I want this moisturizing effect and better anti-inflammatory effect, I use 1.8 or 2.2. And I have very good results with my acne patients who take the retinoids. Okay, it's a filler. You can see 4 milliliter. I like to use okay, one hole here, and it was 7 centimeters, 22 gauge cannula. And I don't like where here is a ball, you know, after the filler. That's why I use long cannula and put some vectors to this side, and to this part, and to this area. And I have brow lift effect a little bit lift effect of the middle part, and I use in this projection a little bit amount of filler and into this fold, and with this lower third we use some filler here, and you have just, and here is the same, one hole with cannula to that part, to the hair, and to this part, to this projection, and in the third part of our face. And you can see just fresh result after 4 milliliter of filler. And this is immediately after, with some swelling because it was injections. And a small amount of fillers in the lips, maybe 0.5. Okay, here with the same. 4 milliliters. Here is 2 milliliters of filler. It's a patient who come to me in the age 78, the first time of injections in her life, and she was afraid, and I was afraid too, because it was after the heart operation, you know. He was with the Validol. I don't know, do you have this heart pills, yes, in your pocket? That's why it was strange, but you know, in one procedure, you know that in Ukraine it is a war now, and a lot of patients from east part from Ukraine live in the west part, and I live in the west part, and a lot of people move to abroad countries, and they come to us maybe for 1 or 2 days just for dentist, dermatologist, cosmetologist for injections, and gynecologist. It's like a medical tourism now in our city. And in the past, usually you made some Botox, after 2 weeks some filler, after 2 weeks some another, but now we have no time. And all the procedures make in 1 day, in one procedure, and now we have good experience with it. And usually we use Celeriderm, botulinum and fillers in one procedure, and here is a 2 milliliter, 2.2 of Celeriderm, and I don't remember, maybe 60 units of botulinum because it's with DAO and with a little bit platysma and upper part of her face. And you can see very good feeling of middle part, and just only 0.3 of filler into the lips. Okay, 2 milliliter, just fresh result. You can see I used a gunshot here, and that's why you have this little bit brow lifting effect, and the last amount I use in this part, yes, in the middle part, to the cheeks and projection of nose. Okay, it's one procedure, one filler of Alexa volume and one electri. I like to use electri around eyes because small amount of hyaluronic acid never caused the swelling around eyes, and you can treat this panda eyes around. Usually we just have few products which we can use in this area, because usually polynucleotides, it's gel, and you can't use it here. It's very long downtime, and my patients don't want it. But electri, you can use it, and you can improve the skin color, and you can see this result after just 1 week. And you can see here is the bruise after the procedure, but color become lighter, and the feeling of middle part is very good, and it's a young person, but this tired face, you know, sometimes we have this patient who in the morning look like tired when they have this special anatomy. Okay, it's after botulinum we have static wrinkles, and I feel it. I feel it with the Alexa Smooth, but you can use usually medium. In the past, I used medium with the electri or with 1.1 and mix it between syringes and have this mild filler with skin reparation, yes. And I use laser resurfacing with dermablade and a little bit filler into the nose. And the same patient, you can see the result. Okay, and the medium a little bit, if you don't want to change the shape of lips, and sometimes our older patients don't want it, we can use just only half an amount from filler, and some filler after the botulinum toxin you can use around the eyes, but it's like a, you know, very, very tiny amount of filler around eyes. Okay, one more, just only 0.5 without toxin. It's just a filler. I think with toxin it will be better, but she doesn't want because in the past she had this weird feeling, you know, after the botulinum toxin in the lips when some drinks go inside, outside from her mouth, and she doesn't want botulinum toxin anymore around the lips. I like this procedure for me, but some patients doesn't like it. It's like, you know, this smile with the gummy smile. Some patients like it with botulinum toxin very much, but some patients doesn't like it. And they said that they like, one patient told me, I am like a Michael Jackson, you know, and she doesn't like it. And now we just fill her lips a little bit with the filler, and she is satisfied. Okay, the combination with the yellow laser, because you know that yellow laser, it's the best laser for blood vessels, for superficial red blood vessels, and I mix it with the Acceleroderm. I used 2.2 with the yellow laser, and peeling, one procedure. Yellow laser, Acceleroderm, and peeling were superficial peeling with some mandelic acid, some lactic acid, very small amount, and after 1 week you can see the glow skin and just one bruise after the Acceleroderm. And the patient from abroad, yes, 1 day we had for the procedure, and after 1 week we get this result, yes, 2 milliliters or 3, no, 3 because lips as well, 2 milliliters in the middle part with the cannula, lips, and Acceleroderm 1.8 and botulinum toxin in one procedure, and after 1 week we just saw the good result, and I used maybe some peeling, one more. time. Okay, for knees, 2.2, one procedure. We can use more, and you will get a longer result. Good skin quality after just one procedure. Okay, electri, just for some athletes, but you can use it for melasma, very, very tiny superficial papules, and one procedure of yellow laser. But you know, this lights was another, and you can see another shades, but good result. You can see it here and here and here and here, just electri and yellow laser. Okay, and poikilodermis, when our patient remember about SPF on the face, but never remember about SPF on the neck and décolleté. And once she went to some place near the river and forgot about this area, and we got this blood vessels and hyperpigmentation. And we used yellow laser with Xeleraderm, one procedure, and now it was twice, but here is after the first procedure, 1 week. 2.2, I used 2.2 Xeleraderm. Okay, and we have some videos. If I use a gunshot, I use this technique with the needle. You can use it with cannula. With cannula, we can use like a sandwich, deeper and superficial. But if you use cannula, you should use medium, yes? Alexa medium, it's a more mild filler. Here I used volume because it's with the needle, it was a bolus. One bolus, 0.4. You can see, I can't see bolus because here is so empty space. A lot of patients has this problem. Okay. This is my colleague. She injected her model with Alexa volume. Now that for chin you can use from 0.5 to 3 milliliter in one procedure if it needs. Our trainers in one experiment, in one procedure, inject Alexa volume 7 milliliters in one procedure, yeah. It was man, that's why. And very, very small chin. Okay, and if you want to create some camouflage effect, in this place you can use cannula and fill this triangle. Okay, this video was for Instagram, that's why it's vertical. Okay, for hands, you can use filler with the needle or with the cannula. If you want to inject very superficial, just only with needle. If you want to inject it more deep, with the cannula will be safe. No, Alexa. Alexa. Volume or medium. I like to use medium, but if it's older patient, you can use volume. But I like to use, it's an old video. I tried to use maybe just 1 year ago, mixed with our Xeleraderm. Filler with Xeleraderm between syringes. For hands, it's perfect because you need more volume and you need mild filling because without any contouring of fillers, and you want just to fill empty space and this smooth effect. That's why I like to use medium with the Xeleraderm. Okay, and I inject very deep on the bone. with the aspiration test. And if I use cannula, I like to use this Easy Guide cannula. Have you ever tried? It's very comfortable, yeah, with this. Mm-hmm. You don't need to find the hole, after the inject.
Easier.
Uh-huh. Okay. You can see I usually feel the cannula, but I have never seen the top of the cannula because I am deep under the tissues. Usually if you're superficial, you can see the top. If you use cannula, you know that if you have a young person, the cannula goes like in the hard cheese, yes? But if you have the elder person, you just put cannula into the hole and like a hot cannula into the butter, Phew, and you are in under the tissues. Okay. A patient with rosacea. This problem is very common in Ukraine. I don't know, in your country as well, yes? The red blood vessels, the erythema, this gray color of the skin. If you use Hyalual, it's a perfect product for this person. And if I want to use the laser, yellow laser, I like to use in one procedure with Hyalual or the first Hyalual and after. Yes, I prescribe the pills, some doxycycline, and then I use Hyalual and yellow laser. And I will get better results, and our patient will have longer results. This is my hand. It's after climb for the rocks, and after 2 months I have this wound because diabetes, glycation of proteins, and I use just only 2 procedures of Hyalual, and you can see my hand like in you. Okay, and one more video with the lips. You can see migration around, and if you want to avoid a little bit more migration, you put the needle not around the lips, yes, inside, not from the border, a little bit lower. I see the needle, but not a color, just a contouring of needle. It's superficial, but not too much. Okay. You can not follow me, but if you have some questions, you can ask me on my own page, because this is page of my clinic and administrator answer that there. That's why you can add me and ask any questions with some protocols about products, and you can sign in our Hyalual.com page, and there is a lot of webinars in record, and you can see a lot of information about our products, about fillers, about masks, sprays, and Hyalual, Electri, and Perfuskin. Do you have Perfuskin or no?
No.
This roller? Mm-hmm, okay. It's good. It's not so often for use, but it's good if you want glow skin but don't want bruises.
It's like a micro needling.
Yes, but needles another, different needles and 5 milliliter of electric inside.
Okay.
Yeah.
Okay.
And if I wanted yesterday some procedure, but today I have to be here and without any papules and bruises, I choose this Perfect Skin. Yeah.
Okay.
Or electric with the tiny needles. I can use 32 gauge needles with electric because inside it's a 30 gauge, it's thicker and I don't like it. Around eyes usually I use 32 needles. Okay, if you have some questions, you can ask me. Okay.
So to avoid migration in the lips area, you don't inject the contour and you're using what product?
Usually it migrates. It migrates always, but if your patient don't want to dissolve, if you have face, yes, and it's like a skim, you know. I'm not artist. Okay, this muscle, yes. If you put filler here, you have different muscles here. That's why filler usually migrates lower. If you put here, but you have this muscle here, it migrates a little bit lower. If you put here, and a lot of filler, very hard filler, very active mouth, very tiny lips, and a lot of small amount of tissues here, and you want to put a lot of filler, usually it migrates here and here and here. And if you want more, you need to avoid to put it here. That's why you inject a little bit lower than contour, yeah? Here, maybe here, maybe here, and inject it to this place. But if you see that mouth is very active, you need to avoid putting it here because usually you can see this border where's filler. Something like that. But usually if you put filler here to the nose, it's usually not migrate. But here sometimes, yes, I like to put it here because if our patient yes, sometimes it's when you have older patient and this empty middle part, you know, something like that. And if you put the filler here, you can a little bit change the shape of the nose, you know, when you put here. And you can make this distance shorter. But sometimes I use it. Usually with elder person, or if our patient dream about rhinoplasty but don't know, and about lips. If your patient afraid about I don't know if it be good for me, maybe a little bit of filler, you can use 2.2 for all of the face, and from that 2 milliliter you can use just only 0.5 into the lips. It's just you can try in lips, you know, for 3 days with the swelling, with the just some shape, and it can improve your quality of lips with the aging processes, and your patient can see some change in the mirror, and usually after this procedure they come to us for the filling, but not for a lot amount. Usually it's maybe 0.5 into the lips. Yeah. Okay. You can, if different scars, you know. I have laser resurfacing and I can combine it with our products. And usually it's minus tissue, yeah? It's atrophic scars. And before the filling with the filler or before the laser resurfacing, I use 2.2. I inject into the scar. I can make this precision.
With the needle?
Yes, just only with the needle and thick needle, not 32 gauge. It's 30 or more, 27 sometimes, and you can separate scar with the round tissues and like a subcision, yes, inside the scar, and then you fill with the 2.2, and you have to make maybe 3 procedures before the filling with the filler or before the laser resurfacing. Sometimes I have very good photo, but I can't share it, yes? No? Maybe I can show you on laptop. I have very good. My patient tried to remove red blood vessels, but he had very thin skin on the cheeks, and he tried to remove it with the diode laser. You know, diode laser, it's a long wave, and skin was so thin, and that the doctor, I don't know if it was a doctor, because it was terrible result, and when he came, my patient, he got this atrophic scars after diode laser and wounds, and okay, here is okay.
You can send it to my WhatsApp. I can share it.
Here is no WhatsApp.
No?
Here, no.
Or email.
Yeah. I can show it in my laptop. It's okay. He came to me with this. I will go. This first photo. You can see, yes, the atrophic scars. Then 1 month. The second photo. It was 1 month after 1.1, 1 polynucleotides, and 1 microneedling RF. 1 month, the second photo. The first, the second, 1 month with 1.1 and microneedling. And the last photo, it was after 2 weeks from all these procedures and with dermablade laser resurfacing. Sometimes it's immediately after laser resurfacing. If I just used laser resurfacing for this type of patients, after this photo, downtime not less than 2 weeks, but this after 1 week. You know, because good preparation before the laser resurfacing. 1.1 polynucleotides, radio frequency, microneedling RF. With the growth factors, I used insulin immediately after radio frequency microneedling. Just put on the top of the resurface. Oh, and I can show you my eyes after different procedures. It is very interesting because usually for me and other doctors just say blepharoplasty. I found this photo on my in my old phone. No, not here. Okay. And you know, it was a surprise for me. I used a few times electri. I used twice polynucleotides, 1 per 6 months. It was microneedling RF, and between these photos, 2 years. Okay. You can see my right eye because this is selfie. Electri. Once per 3 months, 1 per 6 months, it's polynucleotides. Microneedling RF, 1 per 6 months, whole face and my eyes. During the lash line. Very good result. I don't want blepharoplasty. Not now, you know. Maybe after 3 years. Oh, okay. Okay. Good result.
Nice, very nice.
And you can see that this fake lashes.
Yeah.
I wear it because the ptosis was on my eyes. Seriously. That's why you don't have to cancel your previous protocols. You just can improve your protocols with our products. If you want very mild result with lips, use Alexa Medium. It's so mild, it's so soft in tissues. You know, like a natural lips. You never feel this filler in your lips. If you want to improve results from another procedures, if you want to prepare skin with some aggressive procedure, if you have acne, post-acne, some inflammatory diseases, some atopic dermatitis, rosacea, you just can add Acceleroderm into your protocol because you improve the health of the skin, and just only after that you have this beauty. And you have this glow skin and good result, and there's lymphatic drainage after Acceleroderm because you improve your blood circulation, you improve the trophy of the tissues. That's why I like this product so much, and usually I use a lot of these products in my practice every day in my clinic. Me and my workers who work in my clinic. That's why you have to understand what you buy. In the syringe, you have to remember about these advantages of different products, not only about Hyalual products, yes? You have to know what inside the syringe, because if you understand which ingredient cause some complications, which ingredient can influence in some pathogenesis of aging or some processes, you can understand what you can get after this procedure if you need it. Okay, and if you have some more questions, you can ask. No? Okay, maybe later. Maybe later.
The practical.
Yes. Usually.
Maybe we can take a photo with the diploma.
Oh,
so
yes.
we are all fresh
Okay,
and everything, and then
my
we can,
sign.
Yes, and then we can eat.
Okay.
Take a seat.
But maybe